me a while to get it, let me tell you. And I think a lot of this, I'm going to say it, I'm not going to say his name, but I had a really bad OB-GYN. And it's like I was dropping the hints during those visits before having my baby that like, wow, I'm not doing well. And it must be the pandemic. And I must be working really hard. And I was starting to feel as if I wasn't in my body anymore. It was no longer me in control. It was an enormous amount of anxiety. You're not sleeping. My kid's the worst sleep. I'm sure that there are other moms out there that are like, no, my kid's the worst sleeper. And it was just no sleep. I was breastfeeding. And just like this debilitating anxiety, but I kept thinking, oh, this is normal. This is part of it. This must be just my job. But it wasn't until I started talking to patients like in the ER and on the inpatient unit and realizing, and unfortunately, I hate to say this, I feel so bad now. And I kept thinking, wow, patient XYZ, yeah, you don't even know what it's like to struggle. Oh, you missed a couple nights of sleep. Oh, that's funny. I haven't slept for like 2 years. And that's when I started realizing it's like a callus is building over my empathy. I no longer have empathy. I can no longer feel. I can no longer see what my patients need because I'm just so disassociated from my own body.
All right, so we'll go ahead and get started. Ladan, I've known you for years. You know how much I love you.
I love you. You're my Thomas.
Ladan, the people.
You've loved me through my troublemaking years. And hey, sorry, my dog.
You were never that much of a troublemaker in my eyes.
Oh my God. Thank you for saying that. Thank you for saying that. Coming from a child psychiatrist in particular, like I feel better.
You're welcome. Very welcome. Okay. So I know you, but the people listening to the podcast don't know you. If you could introduce yourself, tell us who you are and what you do.
Yes, I am Dr. Ladan Hariri. I am a board certified psychiatrist here in Southern Orange County. And I graduated USC where I had the honor to do training with the amazing Dr. Thomas Hughes. And ever since, we're just, it's our generation of practicing through a pandemic and adulting and killing it sometimes.
Yeah.
That's me.
Last I saw you, you had told me a story about everything you had gone through career-wise. You've made a lot of changes. What's the latest with you? What led you to go into private practice?
So I have to say that coming out of USC, where it's very, very, God, it's just really great training. Like you kick and scream during the process, like it's hard, but you come out with the best training. So when I jumped out of residency, I jumped into everything from inpatient to outpatient, ER, CL, and through a number of unfortunate events, I was pretty much let go from a hospital here in Southern Orange County, along with several other. I'm sorry, can you hear the background noise?
Not really.
That's our vacuum. Okay,
not
perfect.
Really. We can as long as we can hear your voice, you're fine. You got a lot of stuff going on at home too, yeah.
I know, all the time.
All the time.
So along with, there was a massive exodus of doctors from this hospital system that I was at. And what happened was I found myself leaving what I thought was my forever home job, and then being without it, which was devastating. And it was a CL/ER position, which is my personal passion. I love. And then I realized, you know what? As I see the changes in medicine and being that I'm a mom working from home with a toddler, doing telepsych, I think I need to be brave and just jump into private practice and take this on. And I have enough experience at this point where I can do that. And I have the support of my amazing husband, who's also a physician. And he was able to launch my website, launch this great practice. And I specialize in women's mental health. Now, in in between that, as I'm building my practice, I had actually taken on a contract doing inpatient for an outside state. I can't give too many details, for an outside state. And that did not work out well. I mean, I was burned out before leaving the hospital system that I mentioned to you. I was really burned out, like no vacation since March of 2020,
Wow.
working while in labor,
Wow.
giving admission orders while pushing my baby out. So I was really burned out, like working while pregnant 7 days a week. And then also postpartum, like no time off after delivering my baby. So I was burned out. And then that job serving another state, it really pushed me into like the deep end of burnout, where one day I realized, nope, I really have to take a break. I got to step away, reset. And then when I'm ready, I'm going to go back. So right now I'm just doing my private practice concierge and practice. And I very, very light workload right now. And I do that on purpose. I'm very selective about the new patients that I'm taking at this time. But it's like, I love this because look at what I can do. Now I can connect with my loved ones. I can connect, like perfect example. I get to see you. I get to talk to you because we were struggling. We wanted to do this for a long time.
Yeah.
And it was just like, I wasn't functioning. I had no time to do anything. That's where I am right now.
Yeah, you're gonna have to explain to me, because I think John was very upset with you a couple times because you were working.
Yeah.
And
Yeah.
right,
A lot.
and then you
Too
had the
much.
baby, yeah,
Yep.
and you were still stressed.
Oh man.
Is this one of the reasons why you made postpartum, taking care of patients that have, say, postpartum depression, one of the mainstays of your practice? Is that one of the motivations?
Right. So I did that track with Dr. Dossett over at USC, Emily Dossett, who's amazing.
Okay.
And she did the women's mental health clinic at USC, and that was a clinic that ran every Monday morning. And I did that, and I didn't get it. You know, I thought I got it, but I didn't get it until postpartum depression hit me so hard, like a truck. And then that's when I started recognizing postpartum depression in so many of my colleagues, because I feel like all of us just like had babies at the same time, at least in my world.
Trust me, I've been keeping
And
track. Everyone is. Yes, they all have
all
babies
of us, right? It's
at
like
the
I
same
just
time.
have a closet full of presents for baby showers at this point, because I'm not looking at your registry, because if you're a first time mom, you have no idea what you need. So I will help you with that. But that's when I saw, okay, the system really doesn't take care of postpartum. We don't take care of any of the stages of partum, right? Like not the pre, the antepartum, postpartum. We're not taking care of moms, but we expect them to be there for their babies, and then their babies suffer. So it's this horrible, vicious cycle. But what made my situation unique is my husband, who was also at USC, he was graduating from the plastic surgery program. So he had 2 extra years to go. And then he graduated in the pandemic when all the surgery centers were closed.
Right.
So all that could go through my head as I was pregnant in the pandemic was, okay, we don't know when the surgery centers will open. Will they ever open? How long will this pandemic go on? So I better build a good little nest egg in case something happens. And it was very upsetting for my family to see me pushing so hard. But I think once you fall into burnout, and once you fall into postpartum depression, the logic leaves.
Yeah.
It's all emotion driven.
Yeah. So
very long-winded answer to your question. I'm so sorry. I talk a lot.
I mean, Ladan, it's a podcast. If there's one place to be long-winded, it's a podcast. It's fine. Much appreciated. So you mentioned something I think is very important for people to hear, right? So you did an entire rotation with Emily Dossett, correct?
Yes.
Very skilled psychiatrist, works, I don't know if she's still working at USC, but she's very skilled.
Amazing.
With women's mental health. You did an entire rotation and you didn't get it then. You only actually got it once you experienced postpartum depression.
Right.
Could you talk to me more about what it is that what it is that you experienced and how you finally got it?
And it took me a while to get it, let me tell you. And I think a lot of this, I'm going to say it, I'm not going to say his name, but I had a really bad OB-GYN. And it's like I was dropping the hints during those visits before having my baby that like, wow, I'm not doing well. And it must be the pandemic. And I must be working really hard. And I was starting to feel as if I wasn't in my body anymore. It was no longer me in control. It was an enormous amount of anxiety. You're not sleeping. My kid's the worst sleeper. I'm sure that there are other moms out there that are like, no, my kid's the worst sleeper. And it was just no sleep. I was breastfeeding. And just like this debilitating anxiety, but I kept thinking, oh, this is normal. This is part of it. This must be just my job. But it wasn't until I started talking to patients like in the ER and on the inpatient unit and realizing, and unfortunately, I hate to say this, I feel so bad now. And I kept thinking, wow, patient XYZ, yeah, you don't even know what it's like to struggle. Oh, you missed a couple nights of sleep. Oh, that's funny. I haven't slept for like 2 years. And that's when I started realizing it's like a callus is building over my empathy. I no longer have empathy. I can no longer feel. I can no longer see what my patients need because I'm just so disassociated from my own body. Now, what unfortunately ended up happening, which shook me to my core, was I actually had a lovely friend in medical school, and she had she had 3 children. She was a physician, surrounded by physicians, just that person that you never worry about, right? The person that has it all together. And then I came to learn that it was very sad. At about 5 months postpartum, she ended up committing suicide. And that shook me because it's really at month 4 postpartum is what I've learned, that the postpartum depression that you're kind of struggling through and the cutesy little names that we put on it, like baby blues, at the 4-month mark, that's when it skyrockets. That's when you're most vulnerable. And then at that, when I learned that and I had learned this when I was about 6 months postpartum. And I thought, okay, I need to take control now because there is something wrong. And no one really around me said anything that you need to get help, you need to get on a medication. I think everyone was tiptoeing around it and just thought this is just the way that it is. And I think that part of that is cultural. And I thought, okay, I need a psychiatrist. Now, finding a psychiatrist who will take you when you're breastfeeding is impossible. That was really hard. And I would even call psychiatrists and say, look, like, I'll tell you what I need to be. I know what's safe. I just need you to prescribe it to me. So I ended up having to just go to my primary care doctor after looking and looking and looking for a month, and no one would take me. And that hit me hard. That was my journey pretty much, is like that feeling of I'm no longer driving this car called my body.
You went 6 months. You say 6 months before? Okay, so let's back up then. Yeah. Let's back up, okay? Because I'm a single guy. I don't have any kids.
Yeah.
I just
single handsome guy. You guys got it. Guys, get on Instagram, you're on YouTube. Watch this video. Look at Dr. Thomas Hughes.
All right. I'm
just
cutting
saying.
Ladan, I'm cutting all of what you're saying because I'm black and I'm blushing right now. So okay, so I want to go through these stages, okay? Because right now there are guys that are having a baby for the first time. Women might be having a baby for the first time. Even though I'm a doctor, like I've taken care of patients, I did my OB-GYN rotation, but there's a process that people go through with the checkups and everything like that. So if you go back to when you were seeing your OB-GYN, okay, you said that you were sending them hints or you were saying things that should have been picked up on. If you could go back, back to that time you were seeing the OB-GYN, what do you think you would have liked to have seen happen, or what could have changed with those interactions that you had with that OB-GYN?
I should have fired him. I'll tell you, I should have fired him. I should have fired him.
Okay.
And because if you mamas, especially first-time mamas, if you feel like he's not listening to you, if he's not making eye contact with you, if he's kind of brushing off your feelings and saying, oh yeah, that's part of it. Oh yeah, that's normal. Get out while you can. Because what ended up happening is once you get to a certain point in your pregnancy journey, I think it's about 36 weeks, when OB-GYNs, they won't take you as a new patient. You can't just jump ship. And that was the problem, is by the time that I was like in labor for a week, my water had broken, my doctor was totally blowing me off, and it wouldn't induce me because of a hospital policy. At that point, my husband and I were calling just like every OB-GYN in Orange County. And they were like, no, I'm sorry, I can't take you. you're past your due date, girl. Like, you cannot jump ship. So if I could go back in time, I would have fired him. I should have listened to my intuition.
Wow.
Because what ends up happening is, by the time that you are a mother and you are in your postpartum period, a number of things will happen. And then you do get to the point where you're like, yep, that little voice inside me, I'm going to start listening to her. So if you're saying, I'm anxious, I'm not sleeping well, I'm not feeling well, and they're not handing you a PHQ-9, which is a questionnaire that has some screening questions for depression, if they're not offering to refer you to a psychiatrist, if they're not offering to start you on a medication for your depression while you're pregnant, this is a red flag. You need to go to somebody else. And I'm so sorry, OB-GYNs, if you're losing patients, but it's time to change the way that we treat patients.
Wow.
This is unacceptceptible.
Wait, so
yeah, I feel so passionate about this.
You know what? Now that you mentioned that, makes sense, because OB-GYNs are the most, I think they're the most at risk to have lawsuits and things like that.
Absolutely.
So after a certain time period, an OB-GYN won't take you on, because then they might have to pick up what another doctor's been doing for 30 weeks or so. So they just won't do it.
Yeah, they just won't deal with it. And it makes sense, right? Their malpractice insurance is the highest. Like, they have a lot on the line.
Right.
But that's the thing, is postpartum depression and peripartum depression and antepartum depression, those are making you higher risk. So if he's blowing you off for something that's putting you so at risk as a mom, imagine what else he's blowing off.
Yeah.
It's scary.
Yeah. Yeah. Okay.
But you see, that was the other thing, is I chose this OB-GYN because he was in the hospital system I was working for. So it was like, I was like fangirl to this hospital system, right?
Oh, okay.
Loyalty to the hospital system. But now that I'm a mom, I'm like, no. Your loyalty is to you, girl. Your loyalty is to your kid. But these are all things that I had to learn the hard way.
Okay. So now, so let's move up to past the time. I'm imagining it was a very painful experience, but okay, so let's move past that. And now you're what, a month out? You mentioned baby blues. I kind of want to go
baby
through.
Blues.
I want to go through some of the timeline with people with when things might be expected and when things are, abnormal. Like, what time periods are we looking at here?
So we put a lot of cutesy names on it, but now that I've been taking care of a lot of moms, and then also in my CL work at my last job, what I started noticing is, after you have your baby, within even as quick as 12 hours postpartum, when that baby comes out, to like the 48-hour period, we call it, we call it like a postpartum recovery. But what it is, it's a bit of a mild to moderate delirium, is when I reflect back, I'm thinking I was completely detached from reality. I think I was hearing things. I think I was seeing things. I wasn't sleeping. I was very, very hyper. And that happens a lot, moms, is that for the first 2 weeks after you have your baby, you notice like you've got a lot of energy. And what we call it, it's so annoying. We call it the postpartum nesting surge of energy. It's not a surge of energy. It's your body is asking for help because you're not sleeping. If you're not sleeping, no. If you're not able to stay in bed because you're restless, no. That's a problem. So then within the first 2 weeks postpartum, when you have this crash of emotions and you're crying and you're anxious and you're just weepy, we call that the baby blues. And what that is your serotonin, your dopamine, your norepinephrine is just like out of whack. Your estrogen is fluctuating like mad. You've got your body trying to lactate, and that's a whole mess of hormones. So it feels like PMS, but 1,000-fold. It's like the Hulk of PMS symptoms. And we call that the baby blues. And what studies show is the longer the quote unquote baby blues goes on and the more severe the symptoms, that correlates with your chances of developing the postpartum depression symptoms. And then once you hit past those 2 weeks and you're still not getting better, and you're still feeling sad, hopeless, helpless, anxious, panicky, not sleeping, not eating, that's when you're starting to see all those signs of postpartum depression. And you need to jump over to your OB-GYN pretty quick, because they won't see you until 6 weeks postpartum. That's your first visit after you've popped out a baby, unless there were complications otherwise. But in a normal spontaneous vaginal delivery, you won't see your OB-GYN until 6 weeks postpartum. So my recommendation would be whether you're having symptoms of depression and anxiety during your pregnancy or not, have a psychiatric appointment lined up like 1 week postpartum, just in case. You can always cancel it, but have that there in place because you need to have someone keeping a close eye on you.
That's great advice. That's concrete advice. That's really good. Okay.
That's what I'm doing next time around.
Okay. So you're saying 2 weeks out. 2 weeks out is when you should start getting concerned.
Oh yeah.
Okay.
Oh yeah. I would even say really, if you're having those hyperactive symptoms within those first 72 hours, have this discussion with your partner beforehand too. Hey, keep an eye on me. If I'm not staying in bed, if I'm not resting, if I'm not eating, keep tabs on that because this is going to say if I'm going to struggle down the line.
Okay. Are there specific diagnostic criteria for postpartum that people should know outside of what you've already mentioned?
So if we look at the SIGI caps and the PH29,
yeah,
it really still falls into that. Now, here's the twist though. Here's the complication is that a lot of those symptoms go along with your new environmental stressor, which is this beautiful little baby, right? So babies typically don't sleep well. And if you're breastfeeding, they're waking up every 2 hours.
I've heard that.
Okay?
I've heard that from multiple people. Yeah, that's a thing.
Yeah,
huh?
every 2 hours. And then when they go through sleep regression, it's every 45 minutes. And if they're cluster nursing, which means, so pediatricians will tell you, wake up your kid every 2 hours in the middle of the night. They're eating every 2 hours on each boob. Well, actually, the reality is a lot of your babies will cluster feed, which means you take them off the boob, they want the boob back. Okay, so my kid was like, I just want to live on the boob because what they're doing is they're stimulating your body to produce milk. Milk production is supply and demand. And when the kid is going through like the growth spurts in those early days and getting your body to regulate its milk, there are no rules. So maybe in the middle of the night, you're waking up every 45 minutes. Maybe the kid isn't sleeping at all because really for the first month of that postpartum period, your baby doesn't know night versus day. So they're actually sleeping a lot more during the day and they're very, very awake at night. So if you have maternity leave, this can be manageable as long as you don't have another kid or any responsibilities during the day because you can nap when they nap and that can be very protective. But if you're, say, like me, and there's no maternity leave, because this country doesn't give maternity leave if you're 1099, being a mother is not considered a job. If you're in my boat, well, you're working during the day and you need to sleep at night. Kiddo doesn't know that. So the sleep factor with depression, that throws a whole wrench into that.
Right.
Because what is sleep affecting, right? Your appetite, psychosomatic symptoms, right? You're hurting everywhere because you just popped out a baby. So it becomes a little bit complicated. So that's why you need to work with somebody who has experience working with postpartum patients because there's the hopelessness, the helplessness, the worthlessness, and the nonstop crying. Now, if you're having thoughts that my kid's going to die. My kid's going to die. I'm going to die. These ruminating OCD-like thoughts, that's again, another sign that, no, this isn't just the typical baby blues. This isn't the typical first-time mother adjustment. This is something that you need to go to a physician about.
Right. But let's say people are listening from another part of the country, maybe even another part of the state. What would you recommend people do, even if not a psychiatrist? What would you recommend that they do should they be suffering from postpartum depression?
If you have a midwife or a doula, and these are excellent sources for help, and really your OB-GYN should be connected to a psychiatrist. I think that we are living in a time and an age where most OB-GYNs, especially of our younger generation, the ones that are graduating and within the first 10 years of practice, they're recognizing that the well-being of the child is connected to the well-being of the mother. Also, your pediatrician. So, oh my God, shout out to my pediatrician, Dr. Valeria Kozak, amazing. She was the one that also said, you know what, you need to get on something. If you need to stop breastfeeding, it's okay. You need to get on something and get better. So pediatrician, OB-GYN, doula, midwife. If you have to just jump into Instagram, jump into that. There's a lot of physicians that are very well connected there and have a lot of resources. And I learned actually a lot about postpartum depression on YouTube, listening to other moms who weren't even physicians, but hearing what they were going through helped me feel validated that I'm not just imagining things and I'm not a softie. These are real symptoms. So that helped a lot.
Okay. All right, so I think we're at a point where now we're understanding some of the things that someone suffering from postpartum might experience. We're understanding timelines. So let's talk about from your perspective. What might be one of the difficult things that you've experienced as a provider, as more complicated or difficult to treat in terms of postpartum depression? What makes it more difficult?
The sleep. If I can't get you to sleep, I just can't get a lot of things in place. Now, luckily, even if you're and I encourage breastfeeding, right? Breast is best, fed is best. I believe in both. And what does that mean is that we push and push and push for mommies to breastfeed because there's so many benefits to that. And it significantly reduces the incidence of sudden infant death syndrome, SIDS. But fed is best too. So whether it's formula or breast milk or a combination of both, I love it. There's options for sleep in both, okay? And what's really important too is if we have a support system for some respite, we have to harness that as well. So that's really my greatest challenge, is getting those good Z's for moms. And when you're on my Instagram, you'll notice, like, I feel like the majority of my posts are about sleep because I became paranoid. Like, the sun's going down, I'm probably not going to sleep. And sleep became this like huge thing for me. It's like, I have to sleep. Luckily, your kiddos that don't sleep well, it does get better. But moms, if you have a kid that sleeps great, don't be talking about that to other moms. It's like, it's like a salt on the wound. Like, oh yeah, my kid sleeps great. My kid sleeps 12 hours consecutively. Okay, I hate you. I really hate you because I'm struggling. Just don't say it.
Don't throw it in their face, huh?
No, that's a flex. That is a major flex in mom world. Jeez.
All right. Before we move on to the last topics, there was one thing I wanted to ask you about with breastfeeding. You mentioned because what is the concern with breastfeeding in terms of what you might do in terms of a provider with medications? What is the concern there that some people have?
Remember, what you're taking in is going to affect what's coming out of your boobies, okay? So, for instance, I'll give an example. My kid had colic. And what colic is, like, the kid just won't stop crying. And colic is like it's like a blanket term. Like, my little one ended up having acid reflux and a lot of food sensitivities. So what ended up happening was day 2 postpartum, I had to go on a lactose-free diet, which was pretty rough. By week 4 postpartum, I pretty much ended up cutting out everything. So I was on vegan bread and water because it seemed like anything that I ate was making my kid not feel very well. And that helped a little bit. But the problem was that by the time I took him for his 4-month pediatric visit, my beautiful pediatrician said, look, like, you look like you're dying. Like, I don't even know how your body's making milk. And I was way below the weight that I needed to be, way below even my prepartum weight. And I was like a skeleton, just like a skeleton with like these lovely boobs. And but that's the thing, right? If you're taking medication, I miss them. I miss them so much. They were so beautiful. Now they're like little kumquats, but and that's okay. They're still beautiful. But if you're taking a medication, guess what? Your kid's taking that medication too. So, but there are certain medications that are either not as likely to pass into the breast milk, or if they do pass into the breast milk, it's okay. So but here's the other glitch, right? Is that some medications can also affect your breast milk production. And when you're breastfeeding, you are practically obsessed with how much your Haka, which is a hands-free little suction cup that you put on one boob and it catches the extra milk. Like, how much can my Haka catch? How much can I pump in between feeding sessions? Like, it becomes an obsession. You're like in a competition with yourself. How much extra milk can you make a day? So that's really important as well when you're working with a psychiatrist, is do they understand that that is also part of your journey? So are you going to be someone who just doesn't feel comfortable with medication at all? Because there's still solutions for you. There's lifestyle adjustments, there's biofeedback, there's options for you so that you can still breastfeed, which is a very important part of your journey as a mom, and how that's going to affect your baby.
Okay. Last questions for you. All right. I
Mm-hmm.
appreciate all your expertise. You are
Okay.
you're as good as this as I thought you would be. Okay.
Well, the boobies especially, because I also have Dr. Larson, John Larson, who's like the boob man, right? So we know a lot about boobies.
Oh yeah, let's back up. Okay, so the reason why you feel so comfortable talking about boobs, your husband is a plastic surgeon and he does breast
Boobs
augmentation. So
everywhere.
it's okay. You're very open about these things.
I just started a TikTok for him. I'm his new social media
Oh,
person
did
on
you?
Instagram.
Wow.
I started a TikTok and I'm building it. I really wanted to name him Dr. Boobies, and he said no. I said, "What about Dr. Titties?" He said no. So, it is what it is. My little stress ball is actually a boob implant that he brought home for me, like a sample that his rep brought him. Was like, "You want an extra implant sample?" He's like, "Yeah, I love using it. It's great." Relaxing.
I just thought it would be a good idea to bring that up just so people are aware, because otherwise they're going to wonder why the mention of breasts is so comfortable between the two of us.
let me tell you another thing to remember. Size actually does not matter, mamas. I was not even an A cup. I mean, I had nothing, to the point that my dad, I remember, like, before getting pregnant, he was like, Bubba, like, maybe you should go to the doctor and ask, like, is this a hormonal thing? Like, did something not happen? Like, is something missing? Because I have no boobies at all. And then I was still able to breastfeed for 9 months. So I was the little train that could. So if you have small boobies, you can still breastfeed, and don't let anyone tell you can't. I'm back to kumquat size, but man, when they were melons. And I made my whole freezer was full of extra milk with these little guys.
Ladan, I don't know exactly what I'm going to do with this part of the conversation.
I mean, maybe you should just not
switch
edit it
to breast.
Boobies.
Okay. While we're on the subject of you and John, let's take this opportunity to pivot to your podcast. What is the name of your podcast? Who's in it, and what is it about?
We haven't recorded in so long too. I feel so bad, but it's coming up. It's coming up.
Okay.
So our podcast is Inside Out. I'm going to send you the link so that you can put it in the description.
Sure.
And it's a plastic surgeon and a psychiatrist who are husband and wife, best friends, sometimes arch nemesis, depending on, how stressful the day was. And we're just having like banter, like back and forth, talking about plastic surgery, psychiatry, and everything in between. And it is totally unfiltered.
All right, folks, if you're watching throughout, we've changed settings a bit, so you might notice Dr. Hariri is in a completely different setting.
In the bedroom. Sleep. It's like the most important thing.
Right. All right, so we're back. Okay, so you just told us about your podcast, and I'll link everything there. So just tell me, this is sort of off topic a little bit, but how are you and John adjusting to life with a child as professionals? How are y'all adjusting?
Oh man, it's hard. Now, remember, I have family support. So my family lives really, really close by. And then my kid just started like a couple hours a day at quote unquote school, just for a little bit of structure. But it is hard, especially in a pandemic, and especially if you don't have maternity leave, because wow, just the dynamics between you and your husband change. Because whereas John was my baby before, and I could baby him and like take care of him, but now the attention is divided. So that's a tough adjustment for the dads. And shout out first time dads. It says it right in the name. They're learning too. So moms, culturally, we do this where we recognize that moms are adjusting, but we have to have that same understanding for the dads as well. And remember, dad's way is okay too, as you guys are learning to parent. Everyone has their own parenting style, and it's important to have those conversations before the baby comes, because once the baby comes, you're both lacking sleep and you're both stressed out and you're both worried. So it's good to have those conversations before.
Okay. And what are the best parts about having a child, and what are the most challenging parts?
Oh my God, the best part, I mean, where do I even start? It's like this adorable, funny little ball of energy, and life is more fun, at least for me, right? So it's a little bit more magical all of a sudden. So Christmas is more fun. You get to relive childhood, but on your own terms, if that makes sense.
It does.
So, oh my gosh. So like going to Knott's Berry Farm or watching a movie, it's like, it's more magical, or seeing them taste ice cream for like the first time. It's like so pure. And what you get to see is essentially how we should be living life. I mean, when kids are experiencing life, they're like, wow, feel the breeze. Wow, feel the grass. Oh my gosh, that smells so good. They're very much in the moment, and they understand mindfulness like no one else. And that's where we should be. We lose that magic as we grow up. Yeah. And then you said the worst part?
Most challenging. I wouldn't say worst. Sleep. I wouldn't say worst. Most challenging.
The most challenging, sleep. I want to sleep so bad. Actually, so funny stories. I had to have my rhinoplasty revised. Shout out Dr. Jay Calvert. You're awesome. I love you. And I was actually really, really excited for that because I got to sleep like a good solid 3 hours on the OR table. I got to sleep, and I'm gonna say it. I loved my colonoscopy too because that was great sleep too. Oh my God!
You mean getting anesthesia got you the sleep you needed? Okay.
And even during the colonoscopy, you're just lying there. I mean, as a mom, you're never sitting, you're never lying down. It's like, what is this? You know, it's like a spa treatment. I love it.
All right, well, Ladan, that is all the questions I had. Like, we're gonna have you on again. So, folks, if people want to find you, people want to find you, and they're looking for services. What website, Instagram? Give them all your info. How can they find you?
So go on to my Instagram. That's probably the easiest way. You just type in results psychiatry, and you'll see my sassy little face in the icon. Go ahead and message me, follow me. I have a direct link to my website if you want to book an appointment. And then you can also find John Larson through that too, if you need your boobies, taken care of, or anything, head to toe.
He does it all.
John Larson, he does it all. John Larson, MD, and that's Larson with an O.
Okay. Well, yep. Ladan, it's been a pleasure having you on. Could you introduce the crowd to your dog, please? That's been growing.
Oh my gosh, crowd! This is Mercedes-Benz Hariri Larson. And we call her Benzie. Mm-hmm. And she is a rescue Chihuahua Dachshund Poodle mix. And she has more attitude than I mean, this girl went from like homeless to princess. And man, is she just like full of attitude. She'll make you feel pretty bad about yourself, like the judginess, right?
I mean, she's growling at me. She's growling at me, and
she growls at everybody except for
dozens
me.
of miles away.
She's my little girl. God, I love her. Well, I think she's actually growling at my house.
Oh, okay, yeah, probably.
She can hear them in the background, but you know what? They clean up after all the messes, and you got to be good to them. But this is my emotional support animal, and let me tell you, she got me through. Okay. She did. Thank you to my family, thank you to my husband. But like when I'd be breastfeeding, I had like one hand on her at the same time, like while pumping, and she just so good. Oh, she's so good.
Not only you're an advocate for getting good care for postpartum, but you're also an advocate for emotional support animals. Absolutely.
Yeah, if it's a peacock, camel, whatever it is, if it makes you feel good, it makes you feel good. I'm all for it.
Okay. All right, Ladan, we're all finished. Thanks for coming on. Appreciate it.
Thank you for having me. Bye, audience.
All right.